It's one of the biggest concerns facing every single community in the world right now. Do we have enough ventilators? We sent KCTV5's Betsy Webster to try to find the answer for the KC Metro.
We asked 5 hospitals and HCA, which runs 7 more hospitals, for a ventilator count. The only one that gave us a number was here, KU Health Systems, and they say whether that number is enough will depend on you. We've likely all seen the sobering images of the situation in New York, with field hospitals set up and a desperate cry for ventilators. At KU Health Systems, they keep a daily tally. They have 278, which includes older models and anesthesia machines that can be adapted. But about half of them are already being used for people sick from something else. So that leaves about 140 to spare.
Which seems like a lot, and yet what we don't know is what we're going to need.
A group called healthdata.org estimates the peak need in Kansas will be on April 28th, when the need statewide will be 228 ventilators. In Missouri, the date is later and the number about the same. So essentially, the 2 states will have about a month to gather 475. But finding out how we measure up to that predicted need is tough.
Kansas City's a little funny because people don't have to reveal their numbers, and especially the Missouri Hospital Association has a policy, and it's kind of to protect hospitals from data and from having to say specific data. It would be great to know some of that specific data, and that way we would have a better ability to plan it.
That led us to Steve Hager, the Missouri co-chair of Mid-America Regional Council's Hospital Preparedness Committee. He didn't have a number for us, but said this.
Based on the latest models that I looked at as late as today, the curve tends to be flattening out. So the predictions for overall ventilators last 3 weeks has progressively been going down. And I think based on those numbers, the Kansas City metropolitan area has sufficient ventilators for the expected demand.
But there's another factor on the ventilators. The projections assume aggressive physical distancing and hygiene behaviors, which has a direct effect on another number. You might have heard of R0. It's how many other people one person will infect.
If we can keep that down to around 2 or 2.2, we're going to have enough ventilators. If that number's at 4, we're not going to have enough ventilators, and we're going to be in a crisis like New York.
That's why they say it is so important to keep up those protective behaviors for a month or more. Because remember, the peak here isn't expected for another 4 to 6 weeks. Betsy Webster, KCTV5 News.